So then after the surgery,
Okay.
we have you in a surgical bra, so
Okay.
it gives you good support. You can wear that until we follow up with you, or you can, if that's not comfortable for one reason or another, you can also use any other kind of sports bra that's supportive. Typically ones that zipper in the front are the best, so you don't have to be stretching your arms over and really trying to yank something on. So some sort of supportive garment for the breast is good. We will see you in a week after surgery, and we just kind of check on everything, make sure everything is looking good. If you have any concerns before that, you just give us a call, and you're welcome to come in. But as far as restrictions go, no heavy lifting greater than about 5 to 10 pounds for a good 4 to 6 weeks. That just helps to allow that implant to stabilize in there, your body to get used to it, the muscle to relax, not to pull or mess anything up in that initial healing phase. So no stretching your arms way over your head. You can wash your hair, you can get a cup off the shelf or whatever, but just no strenuous repetitive activities, things like that. I don't want you just walking around like a little T-Rex. You gotta still move and function, but just be aware that you had something done. It was a major surgery. Those first few days can be a little bit rough as far as pain and muscle spasms go. We do give you Valium for muscle spasm and Percocet typically for pain. If you don't have that much pain, you can always use Tylenol or ibuprofen, but we do give you that just in case. But you have to be aware that once you start feeling good, that you still had surgery. So that's typically the normal recovery period.
Well, no lifting is gonna be hard for me. I already paused my gym membership for those 2 months.
Well, typically, typically, like I said, about a month, and then you can, if you're still sore, then you can give it a little bit more time, or at that point, you can start getting back into it easy. You don't want to just stop doing anything from having the surgery and then go back in and hitting it, just like you did before. You want to ease into it a little bit.
I was gonna do like a basic, like Planet Fitness, because I do F45. That's a little intense to jump back into, so I was just gonna do that and do like treadmill stuff in the meantime. But and then I heard it's more painful doing under the muscle than so.
It is, and muscles have a lot of nerve fibers in them, and we do, like Mark was telling you about, that dual plane. So when we put that implant under the muscle, we get it under there by releasing the lower portion of the muscle. So that comes off of the chest wall, and that's where you get a lot of that pain. If you do it just above the muscle, then you do typically have less pain. But then it comes with the different trade-offs. So it's a short-term pain for what we feel like is a longer-term benefit.
Is there antibiotics to take after too? Or?
Yeah, we will give you a course of antibiotics, and it's just prophylactic. It's one of those things where some people may not do that. We do. The risks and benefits, we feel like it's not a bad thing to take them for a week. It's just a week, and it just helps to prevent anything from maybe creeping up on us.
Sounds good. Anything else you can think of?
That's pretty much it.
All right. Well, if you have any other questions.